Hello dear all, welcome back to my YouTube channel. So in this lecture on Mesopotamian medicine part 3, the ancient civilization, we call it as cradle of civilization from the era 5000 BC. So I have crafted them to flow like a story with the educational points as well as interesting illustrations. So the most fascinating chapters of ancient medicine, the Mesopotamian healing practices, the first civilization in the world, yet they had quite advanced in their medical practices with their magical rituals and advanced surgical techniques. The immense contributions of King Ashurbanipal will discuss later in this lecture. So let's travel back 5000 years ago to the land between the rivers Euphrates and Tigris. Just a brief recap. In the previous lectures on the Mesopotamian medicine, part 1st and 2nd, we already have seen the law code of Hammurabi with Mesopotamian justice. His era was between 1728 to 1686 BC. He has given 282 laws. The Code of Hammurabi was engraved on a 2-meter high stele found in 1901 in Susa, Iran, now preserved in Louvre, Paris. This is a law code found on polished diorite with 282 laws for regulation of society, family life and occupation and conduct of physician. So here the ancient Mesopotamia law meets medicine. So this is a true civilization 3100 BC with the development of cuneiform writings established by Sumerians. We can study the culture of ancient Mesopotamia. Extensive use of writing style for several centuries was practiced. The wedge-shaped marks made by stylus on wet clay tablet deciphered in 19th century by George Grotfriend. So we have already discussed this in the previous lectures on Mesopotamian medicine. Now we discuss the contributions, the key roles of various healers. So before proceed further, just have a look. The civilization, the people living in southern Mesopotamia were called as Sumerians in 4500 to 4000 BC. Assyria is ancient kingdom of North Mesopotamia. The era 721 BC to 633 BC, people called as Assyrians. Babylon is the chief city of ancient Mesopotamia in 3000 BC and people called as Babylonians. So the people of Mesopotamia were Assyrians, Sumerians and Babylonians. So these picture illustrations taken from internet. Assyrians were fierce people, warriors. The picture shows the lion hunting. The Sumerians and the Babylonian king Hammurabi, whose contributions we already discussed. This cradle of civilization was advanced in agriculture, irrigation, and healthcare, which is the temple of Gula. Ancient Mesopotamian medicine gives Ashurbanipal the influence of this king who had library in his palace. He loved the books. His era is from 668 to 627 BC. The library at Nineveh, an ancient city in Assyria, were 30,000 cuneiform tablets organized by subjects and had labels too. His palace was set on fire during battles, and clay tablets got baked in the heat. Ancients had medical knowledge which is available to us by decoding these tablets. The language was decoded in the previous century. Tablets provide historians with the opportunity to glimpse the culture of ancient Mesopotamian civilization. These tablets serve as medical documents. 660 medical tablets are found in the library of King Ashurbanipal, written in the cuneiform style. They revealed the extensive knowledge of gynecological care, surgical techniques, and even pharmacology. So these are the pictures available on the internet describing the contributions of King Ashurbanipal, who loved the books, and the 30,000 tablets were found in his palace which were burnt. So they got baked. Thus the clay tablet provide us the key information on the medical aspect of ancient Mesopotamia. The healing wasn't just medical in ancient Mesopotamia, but it was spiritual, symbolic, as well as sacred. Three main figures stood at the center of care: the Ashipu, Asu, and the Baru. Each had a distinct role. Ashipu acted as priest healer, using incantations and rituals to drive out disease causing spirits. The Asu, in contrast, were practical physicians, masters of herbal remedies, surgery, and wound care. Bari, though lesser known, also contributed to healing practices, possibly bridging the gap between the mystical and the material. They used the medicines such as herbs, incantations by Ashipu physicians. These physicians, also called as priest, the sorcerer, the worshipper, they relied on magical charms, spells and incantations and amulets and other objects too, which believed to have supernatural power. Occasionally prescribed drugs. The rituals were practiced to ward off evil spirits and restore harmony to body and soul. Asu, they were the physicians who practiced with herbal remedies. In 2100 BC, four clay tablets were found which described surgery. They treated people with medicines made from minerals, resins, spices, and plants. Treatment of wounds was done by washing, bandaging, and making plasters. They removed pus from pleura and knife was used for scraping skull. Asu had used few instruments shown in the picture. So they even performed and described surgery, especially the bandaging techniques of the wounds. The knowledge of plasters for dressing wounds in ancient Mesopotamia was quite advanced. Mixture of medicinal ingredients applied on wound held by bandage. Heating a plant resin or animal fat with alkali. After heating, it forms a soap which is may be used to ward off any infection and also cleaning of the wounds. Occasionally, he would cast a spell too. Clay tablet mentions the use of sesame oil for post-operative care of surgical wounds, may be supposed to have antibiotic property. They also used the various instruments. They had a health care, and the temple of Gula is the most renowned. It was supposed to be the temple for healing. Thus, along with Ashipu and Asu, the health care was also advanced. Ashipu interpreted illness as a disruption caused by spiritual wrong. They used the amulets and the charms, and the diagnosis was not just physical, but it involved asking the spirits which caused the diseases. The temple of Gula is very famous temple. The healing goddess depicted as a dog. Excavations of temples did not reveal any signs of patient housed at the temple, as was the case in the temples in the Greek medicine. These temples may have been the sites for the diagnosis of illness. Temples were also libraries that held many medical texts. Homes were the primary centers for health. A small hut near river was set up for the patient, as they believed that river had the power to carry away evil forces that caused illness. It is very interesting to know the healing care in this temple of Gula. It is thought to purify body and soul. Thus, the medicine in Mesopotamia was tightly intertwined with law too. So, this lecture having very high academic value with respect to the educational points, and also the illustrations are given which makes it interesting to study. Thus, the cradle of civilization was quite advanced at 5000 BC. The medicine was a blend of science, spirituality, and society. It had an influence of the god powers. So thus I hope you liked my lecture series on history of medicines, and do study organon of medicine in my other lectures. Thank you.